A fast-growing trend is for mums to have some post-preggy surgery after baby has arrived, and with tremendous success. We say welcome now to one of South Africa's most sought-after cosmetic surgeons, Dr. Craig Shaw. Craig, welcome. Like we said, this is becoming more and more popular, is for mums to, invest in some and save up for some post-preggy surgery. What exactly is cosmetic surgery?
Aveka, cosmetic surgery is principally a surgery that is designed to improve your physical appearance. So it may have some health benefits, naturally, but the primary aim is to make you look better. Now, in our world, that would comprise of mainly one or two things. You may have something you've always wanted to change, for instance, a nose,
Yes.
ears, something of that nature. Or alternatively, you want to go back to looking how you looked maybe when you thought you appeared a bit better.
Yeah.
So pre-pregnancy would be a good example, before you lost or gained some weight. And then obviously aging, so a return to a more youthful state. I do want to point out, however, that we are primarily doctors. We do our medicine first, and then become, in my case, a plastic reconstructive surgeon. This means that we have to follow the principles of safe practice first.
And what's
first
ethical
and
and what's the right thing to
ethical.
do?
Okay. First and foremost, obviously, safety.
So what you're trying to say is you will determine, you don't do it unnecessarily. Like if, we've heard the stories about people who want to go and have excessive surgery. We've watched that TV series where things have gone wrong and all of that. You will do it if it's right for that patient. Is that what you're saying?
I do try, and naturally one has to try and assess, is this the correct for this person, and is it going to give the outcome which they expect? Because sometimes the surgical success is not the same as a success from her point of view, or his may have wanted a different outcome.
It's not a miracle. It's not like a fairy godmother and a wand. Okay,
Correct.
you can only do what you can do. So post-preggy surgery, what does that involve?
Well, there's obviously many things that are requested. I would say probably one of the more common requests in my practice, of course, is that of liposuction. Yes. Because of the weight that is often gained during the time of pregnancy. Now, the lipo, or the removal of that fat, may either be just as a kickstart to get a person feeling better about themselves, make it easier to go back to the gym, and just get started. It doesn't mean
you can continue to eat cake and chocolate every day. No.
Though we are people, and we do, it's good to have something that you enjoy from time to time. But having said that, yes, you need to maintain it.
It's a stepping stone to getting your sexy back.
It may be a stepping stone. Alternatively, of course, is a lot of people nowadays do a lot of time at gym, look after themselves very, very well, better than myself for sure. And it might be those last little fat, stubborn deposits that are difficult, that you get genetically, that you can't get rid of in any other way. This may be the reason for it.
Okay. How soon after baby arrives is it normally, would it be safe for mum to even consider having a little nip and a tuck?
Well, the safety, there shouldn't actually be any difficulty with immediate surgery. So from a safety point of view, certainly if there's something that needs surgery straight after any pregnancy, it's safe and well tolerated and there's no problem. However, from a cosmetic point of view, I would say a fair time to wait is about 4 to 6 months. And the reason behind this is during that early time, you should be looking after your baby. I mean, you shouldn't be in any way inhibited from the pleasure of having a child.
And your body is still changing.
Absolutely.
Yeah, it's still changing after
so you are, though it is physically possible, but your goals at that stage should be yourself, your child, not necessarily having to worry about your own recovery at that stage.
So consider it about 4 to 6 months afterwards.
It's just a time, but that's a fair.
Okay.
I think a lot of considering these days, a lot of people are working. A lot of ladies have good careers. Many times I get the request, just before going back to work. Obviously, one doesn't then want to take another time off work, and towards the end of your maternity leave seems to be a rather logical time to do it.
Yeah. Now, a lot of women talk about or wonder about having sort of surgery, breast surgery, enhancements there after having baby. Would you still be able to breastfeed? And a lot of them still want to continue breastfeeding. Can you breastfeed after you've had a boob job?
Generally, there is no change in the ability to breastfeed.
Okay.
Obviously, in some cases where there's a reduction, a breast reduction, some of the breast tissue is removed. So one could say that there is less breast tissue, and possibly there would be a reduction in the amount of the milk. But theoretically, there should be no change or change in the ability to breastfeed. It should not interfere. No.
Now, how important is it to sort of be able to maintain, you know, your whatever changes you've made to your body? You should still, like we were saying, follow that healthy diet, do exercise, obviously after a certain safe time. The surgery doesn't mean that this is, you know,
no, it doesn't. Obviously, it's helpful, and one hopes that the surgery would be durable. But definitely, look, from a health point of view, you should have a healthy lifestyle any which way.
Yeah. Well, like you said, it does kickstart. So it's a kickstart to make you feel good about what you see in the mirror, and then continue the work after that.
But, for instance, we were talking about liposuction. If you're removing certain areas, the fat, the excess deposits that you can't get rid of any other way, and you don't want to look too thin maybe in your face or in the breasts or the like. If you do eat excessively, remember, you can still gain weight. We have admittedly a finite amount of fat cells in our body, and I can remove some of them, but you still have the rest.
And it comes back in other places, is what I heard.
Not necessarily, but the fat cells that you still have, you can fill up if you with indiscriminate.
Okay, they suck up the fat.
Yeah.
All
well,
right,
suck up is a bit of a strong word.
So be wise about it, and of course, a good doctor will advise you properly and decide if you actually really do need that surgery at that time. Some wonderful insight. Thank you so much to Dr. Shaw.